There was a competitive grant program run by the Michigan Rural EMS Network. They were looking to partner with a number of communities across the state to try and improve the survival rates from out-of-hospital cardiac arrest. We applied to be a MyRescue community in year 2 of the program and were selected, and it has made a tremendous difference in our community.
Prior to becoming in the MyRescue community, we were much less likely. We were probably around the national average for cardiac arrest saves, but with the implement of high-performance CPR training and the public access to defibrillators that wasn't there prior, I think we've improved those stats significantly.
MyRescue community has a number of different responsibilities. First off, we need to create an AED registry for automated external defibrillators. The MyRescue grant was able to fund some of those, and we were able to strategically locate them throughout the community, so that was very important. The registry is also important because prior to that we didn't know where they were located already, who had one, and so forth. And so we've been able to reach out and identify all of those locations and make sure that they are in the places where they should be and that they're maintained and that there's training involved. And so we've provided AED training whenever AEDs are deployed as well.
Prior to becoming a MyRescue community, our stats were right around the national average for cardiac arrest saves. But with the implementation of the training and more public access to defibrillators, we've seen a great improvement in the rate of return of spontaneous circulation with cardiac arrest events.
As part of our MyRescue program, that helps to reach more people and have them understand the entire system from the time that an emergency is noticed or determined, through dispatch, through a bystander, hopefully starting CPR either with telephone instructions or because of further training, and then on to response by first responders in our 9 surrounding townships or city paramedics here in the city. The next phase, of course, is the advanced life support phase, and that's what we do throughout 1,700 square miles of Alpena County, and then hand off to the hospital. Many times those patients are transferred back out, and that's where our mobile intensive care unit comes in.
So high-performance CPR training has changed the way that we look at cardiac arrests in general. We found places in the community where there was a high level of traffic, but not an AED accessible, readily accessible.
So we're really dealing with a comprehensive system for emergency cardiac care here in Alpena, and our partnership with MyREMS has certainly helped to bring that to reality much more quickly.
So we've done multiple public education classes with hands-only CPR and making the public aware of some of the things that we're doing, as well as some of the techniques that lend to high-performance CPR.
Well, I think the biggest benefit is survival. Across the nation, I think Tyler may have mentioned that the average survival rate of out-of-hospital cardiac arrest is about 8% or so. In King County, Washington, which is where the MyRescue curriculum is developed from or mirrored from, they are seeing survival rates of upwards of 60%. And we've already seen a difference here in Alpena by putting all of the links in the chain of survival together: early access, early defibrillation, early CPR, early ACLS. The opportunity for successful resuscitation was much less prior to our MyRescue implementation. After that, by doing some key things like the pit crew concept for high-performance CPR and the advent of the CPR quality meters, which we now use on all of our patients and in all of our training to identify, is the compression exactly where it should be in terms of depth, is the rate and ratio exactly where it should be, and providing that data back to do quality improvement afterwards makes a big difference. But even at the time, the live feedback allows us to do much higher quality CPR, and the chance of a patient actually coming back with spontaneous return of spontaneous circulation outside of the hospital has increased significantly since we started using these new procedures. I would certainly endorse the MyRescue initiative. The Michigan Rural EMS Network has been around for a number of years now, has done a number of successful programs, but MyRescue really makes a difference on the ground. Where the people are, where the communities are, and especially in rural communities, helps us to put all of the links in place so that we can really make a difference in survival. So I think that has been a tremendous thing for us. The components of the MyRescue program have helped our community to be much more effective in putting all of the different pieces together to maximize survival for our citizens. Alpena County, the 9 townships in the county, the city itself, all work together very, very well and are all doing perfectly orchestrated high-performance CPR. Law enforcement has been trained, dispatchers are trained, the first responders are trained, we're training the public as quickly as we can, AEDs have been placed. My Rescue has put it all together in one big package, and the winner is the citizens of Alpena County. That's where it really makes the difference. Where we used to send an ambulance and a rescue, now we dump the station on cardiac arrests in the city. We may send 2 ambulances and a rescue, whatever we have available, so that we have more rescuers to do super high performance CPR on the scene and try and make that difference very quickly for our residents. And the results are obvious.